Hi, this is a video which explains my dad's story. I realise we talk about his story quite a lot, but it wasn't actually recorded in full anywhere. So many things happened to him. This video might be a bit long and I apologise for that, but I feel like it's important for people to understand his journey and the journey that many deaf people face when trying to access healthcare. Deaf people often talk about doing the nod. It's a nod where they agree to things they don't understand, but this is because they're facing so many barriers and having constant battles to access information in their first language. They become tired. It's so important to remember that they may be facing constant barriers and battles, meaning that their diagnosis or treatment of their health issues can be delayed, which can have serious effect on their well-being. So throughout the last few years, even before Dad became ill, our family, Dad and I have participated in consultation events to provide feedback about healthcare and the access issues deaf people have been facing. I'll go on to talk about the specific issues he had accessing healthcare and spoken language agencies. So in 2019, my dad experienced an allergic reaction to fish. It was actually in a drink that he consumed without realising it had fish in it. He called me and I was actually in a hospital in labour, and on FaceTime I could see that his face was really swollen. I panicked and said, "You need to get down to the walk-in centre now." I couldn't go with him because I was in labour, so Dad went in but had real problems with communicating with him and they didn't provide an interpreter. So my sister arrived and explained that he'd eaten fish and he was allergic to it. So they checked his heart and it was dangerously high. So they sent him to Arrow Park Hospital. I was already there because I was in labour, and they again didn't provide interpreters. My sister had to interpret that whole interaction. They put him on a drip, which really helped him, and he left the hospital at the same time as myself. So he actually met his granddaughter for the first time in the car park. So we fed that back and explained the issues that deaf people, and my dad in particular, have been having. In the following year, Dad tried to access the walk-in centre again, and we phoned ahead of time and asked them to start looking for a sign language interpreter. They couldn't because they didn't know how. Despite making lots of phone calls to them and to DA Languages, who were the contract providers, we didn't get anywhere because DA Languages said that they couldn't take the booking directly from patients. We gave up in the end and booked our own sign language interpreter, who was a local interpreter, and we agreed to pay her as a family to attend. So she did, and she interpreted that process, and we made a complaint, and it was agreed that the walk-in centre would reimburse us for the cost of that interpreter. Father was offered a follow-up appointment and initially was offered a VRS appointment. Lots of deaf people do not like using video relay, especially for medical appointments. It should only ever be offered as a last resort. So if in a case of a real emergency, or if you've tried looking for an interpreter and you've not been able to find anyone, then that's fine. But as a first option, it should never be used. So they gave us an appointment at a face-to-face appointment at Arrow Park, and we reminded them, please book a sign language interpreter. The day or two before, we realised we'd not heard anything, and we tried to call the hospital and DA Languages, and again didn't get anywhere, but could work out from what they were saying that no sign language interpreter had been booked. So we contacted a agency by the name of Signalise. They agreed they could provide us an interpreter, but because that day the appointment consisted of 2 appointments, they couldn't cover both, so they covered one and I interpreted the other. We submitted another complaint, another formal complaint to Arrow Park Hospital, and within their response, they stated they will learn from their experiences, and our response was, well, in future, can we now use Signalise? Because our family keep having issues getting access to interpreters. Their response was no, that we couldn't. And we raised it with them that DA Languages would not take bookings from patients, but their response was no further action would be taken. So this then leads us to talk about the eye problems specifically. So Dad was having problems with floaters in his vision, and he decided to go to Vision Express, who refused to book him a sign language interpreter, and they sold him a pair of glasses based on his old prescription without checking his eyes. He continued to have problems with his vision, so we decided to ask the GP for an appointment. They told us that they couldn't give us an appointment for 2 weeks because they had to get an interpreter and it would take that long. So I phoned the GP the next day and they would speak to me. And this is another example of barriers that deaf people face, because they can't access healthcare or have autonomy over their healthcare if family members are calling for them. So the GP recommended that we go to a local NHS optician. They checked his eyes and straight away said that you've got a detached retina and you need to go to Arrow Park today, because the longer you leave it detached, the more sight loss occurs. So it's really important that you get there now and get it sorted. So we raced up to Arrow Park. Again, I interpreted that interaction. We were there all day. They did lots of tests on Dad, and they said at the end of the day, no, sorry, we can't treat you here. You need to go to a specialist hospital. So go home, you'll receive a letter and wait to hear. And we were really suspicious of this, because we thought, well, hang on, the optician this morning warned us about the blindness that would cause. So we waited for quite a while, hadn't heard anything. But my dad had no way of contacting the hospital to ask what had happened to that appointment, which meant I had to go and explain what happened, who my dad was, and why we needed to know about the appointment time. They gave us the appointment time and told us when it was, but this is just another example of the barriers that deaf people face when they're trying to access information about themselves and can't. Whilst waiting for the appointment, not long after, Dad woke up one morning and was completely blind in the affected eye. He phoned me in a right panic. So I went and picked him up and took him to the St. Paul's Hospital because they have an A&E walk-in. Again, at the time, I was really heavily pregnant, near my due date, and we spent the whole day there without an interpreter. They did lots of tests, and then they asked me to tell Dad that he had cancer, which obviously was quite a shock. They told us that they would send some information in the post and that he should read that information to get an understanding of what might happen next. We were left feeling really upset and anxious. Then when we received the pack in the post, it was over 100 pages, and it talked about the different treatment options they might offer. One of the options, it said, we might take your eye out. And I said to Dad, that's not going to happen. And that was wrong of me, because I was a bias. I influenced that translation and made him think it wouldn't happen. When we got to the hospital, they said, yes, we need to take your eye out and we need to do it quickly, because we have suspicions that the cancer is quite aggressive and it would spread. So remember, at this point, I'm still interpreting. The first time my dad saw an interpreter, when he was at the hospital with his bag, thinking that the operation would happen that day. The operation was actually postponed to make sure interpreters could be present. I knew that wouldn't happen without me doing something. So I contacted local interpreters and said, look, a spoken language agency is going to put out the request. When you get it, please say yes, which they did. Afterwards, the operation, Dad just wanted to go home. He didn't feel comfortable at the hospital, and my sister took him home to care for him. At the same time, I just had the baby the day before Dad had the operation, so it was a really emotional time for us all. Me with a new baby and him as a deaf BSL user losing his sight in one eye. Dad should have had access to the eye hospital walk-in centre. It's like a special A&E, but just for your eyes. On 2 occasions, we tried to contact them and say, he's deaf, he wants to come in so you can check his eye because it's been removed. Please, can you book sign language interpreters? And again, they refused to book anyone. So we called the department who took the eye out and they agreed to see Dad. But again, I had to go with him with my baby and I was breastfeeding and interpreting at the same time. The experience was so awful. We had lots of appointments for prosthetic eyes or scanning following this. And again, the interpreting provision was really haphazard and I had to do most of that interpreting. When he received the biopsy results, Dad was told it was bad news because the cancer was found to be very aggressive. And they said if they didn't catch it early enough, it meant that it would come back and it would come back in his liver. And if that was the case, there would be nothing they could do and he'd be classed as terminal. So straight away, we just think about all these delays that had happened in the treatment and the diagnosis of the cancer, which was really worrying. I'm going to leave it there because I'm just conscious this video is already 11 minutes. So I'll explain the rest of its story in part 2. All right, thanks for watching. Bye.